Good morning. Thank you for joining the webinar. My name is Robin. I am a health coach and a registered nurse with Strategic Health Services. I'll be presenting the Healthy Habits to Prevent Heart Disease webinar this morning. February is American Heart Month. The American Heart Association helps lead the fight on heart disease through public awareness, education, and the funding of medical research. Preventing heart disease means making smart choices now that will pay off for the rest of your life. Heart disease is the leading cause of death for men and women, and the CDC reports that 700,000 people die of heart disease in the United States annually. Think about what's important to you in regards to your heart health and move forward on the road to prevention. Here are the objectives for the webinar. The goal is to provide a basic overview of heart disease, identify risk factors, and ways to keep your heart healthy and reduce those risk factors. Set some goals for healthy habits and the importance of a good rapport with your doctor. Whether you're running a marathon or preventing heart disease, every journey begins with one step. I hope this presentation gives you some ideas for steps that you may want to take towards better heart health. Cardiovascular disease, also called heart disease, can include a number of different heart problems, many of which are related to a process called atherosclerosis. Atherosclerosis is a condition that develops when plaque builds up in the walls of your arteries. This buildup narrows the arteries, making it harder for blood to flow through. If a blood clot forms, it can stop the blood flow. This can cause a heart attack or a stroke. Risk factors are conditions or habits that that make a person more likely to develop a disease or see an existing disease get worse. And important risk factors for heart disease that you should know is having a high blood cholesterol, smoking, being overweight, high blood pressure, diabetes, being physically inactive, and having a family history of early heart disease, as well as age, 55 and above for women and 45 and above for men. And now we're going to look at reducing your risk. So looking at those risk factors, smoking cessation. So stop smoking, becoming more active, maintain a healthy weight or lose weight, eat better, make better dietary choices, know what your numbers are, know your cholesterol number, know your blood sugar, and then managing your blood pressure. On the next slides, I'm going to go into more detail on each of the risk factors that you can control. And the first one is smoking cessation. Cigarette smoking causes about 1 in every 5 deaths in the United States each year. It's a major risk factor for heart disease for both men and women. And quitting reduces the risk of coronary heart disease, stroke, and peripheral vascular disease. Your risk of heart disease and heart attack increases with the number of cigarettes that you smoke, and people who smoke do have a 2 to 4 times higher chance of having heart disease. It's the main preventable cause of death and illness in the United States. The nicotine in smoke affects your heart because it decreases the amount of oxygen to your heart, it increases your heart rate and your blood pressure, and it damages the cells that line the coronary arteries and other blood vessels. If you're thinking about quitting, we do have a smoking cessation program that's available through the My Pathway to Health program. Being more active. So physical activity is going to increase the length and quality of your life. If you go onto the American Heart Association's website, the recommendation is 30 minutes a day, 5 times a week of moderate exercise. But you can also get the benefits if you divide your time into 2 or 3 segments of 10 to 15 minutes per day. Making it a habit can sometimes make it a little bit easier to get into that routine. So if you only have, in your day, you have a busy day scheduled, or you know what your week ahead is, you take 10 or 15 minutes in the morning if you have it, and then break that up and use 10 or 15 minutes in the evening. And sometimes just getting on track with exercise, try to pick an exercise that you like. So, it's a little easier to do something if you like it. And then one that you've talked about with your doctor if you, depending on your health history. You may want to try something new like Zumba or a Wii Fit, a new exercise class or machine if you belong to the gym. An easy way to get exercise is walking. It's a good form of exercise and you just need some comfortable shoes. You can sneak in more exercise into your daily activities by taking the stairs instead of an elevator. Park further away at the store. And if you're at the store, walk Walmart or the grocery store twice. If you have to get to the mall, walk the entire mall. Take that extra time to get those extra steps in. And start out slow. Start out if you are trying to do an exercise routine or get into some sort of a healthy habit with it. Try 10-minute increments of exercise, starting off maybe 10 minutes 2 or 3 times a week, and then slowly working yourself up, because the hardest part sometimes is just getting started. So if you can get yourself started at a lower amount of time, you may find that that habit becomes more of a habit and it's easier to stick with. One other thing you could think about is if you're exercising, find a friend, a co-worker, your spouse, somebody that is interested in doing the same activities, and having that person do those activities with you will help keep you motivated. The My Pathway to Health website has an exercise tracker. You can log your activity there and keep yourself on track, and it also is a good way for your health coach to keep up with how active you are. Maintaining a healthy weight is a controllable risk factor for heart disease. If you're overweight or obese, you're at a higher risk for developing chronic conditions, such as heart disease, high blood pressure, and diabetes. The term BMI, or body mass index, it's the number calculated from your weight and your height. It's a screening tool used by medical professionals to evaluate possible weight problems. It's not a diagnostic tool. To determine if excess weight is a health risk, a healthcare provider would need to perform further assessments. So you'd want to have a physical exam. Your doctor would want to evaluate your diet, your activity level, your family history, and any other health screenings that your physician deems necessary. It's important, if it's determined that weight is a risk factor, that just losing 5 to 10% of your total body weight can have a positive impact on your overall health. This slide is a breakdown of BMI standards. So it shows you what the BMI number means in relation to the weight status that it represents. You'll find this number on your personal health profile. And if that number's changed, if you've had some changes, you can log into the portal and use the BMI calculator that we have. To decrease your risk of heart disease, you need to maintain a healthy weight or lose weight if you're overweight. And if you'd like to lose weight, it's important to view these changes as a new way of life, as a healthier lifestyle, not a fad diet. Fad diets are usually temporary. They lead to weight gain once you change that style of eating. And sometimes the key to successful weight loss is burning more calories than you're consuming. So that old, move more, eat less. And a lot of times the challenge is more mental, so you have to get in the right mindset. And that's where that first change begins. Something has to click, and you need to make that choice. And then taking a closer look at what you're eating and at your diet, and starting off slowly. Sometimes making so many changes at once can be overwhelming. So start off with small goals, like drinking more water or cleaning up and having, a very healthy breakfast to start, and then moving into, cleaning up your snacks or watching that you're not taking in too many calories. So starting off slow, even planning for the week. A lot of times the planning and preparation can be where the success starts. So if you know that you're, shopping for the week, making sure that you're sort of meal planning and thinking about the week ahead and having those better foods on hand, taking a healthy lunch with you to work and snacks instead of having to go to a restaurant or into the cafeteria where you can sometimes make bad choices. Simple things like increasing your fiber intake, fruits, vegetables, whole grains, to keep you feeling fuller longer. And then also use a smaller plate. Sometimes portion control can be an issue, and sometimes if you use a smaller plate, you can trick yourself into thinking that you're actually eating more than you are. This slide is just a representation of healthy eating habits, and just focusing on choosing lean cuts of meat when you are shopping, looking for a diet that's rich in fresh fruits and vegetables, and focus on a rainbow of colors, looking at whole grains and foods that have a higher fiber content, reducing added sugars, minimizing foods and beverages that have added sugar or contain refined sugar. When you're preparing meals, use little or no salt. Try a salt substitute like Mrs. Dash, or different spices to add extra flavor. The goal is to keep your sodium or salt intake to less than 2,300 milligrams a day. If you're consuming alcohol, doing so in moderation. And then when you're selecting fat-free skim or low-fat dairy products, your cheese, your milk, your yogurts, and then the American Heart Association actually recommends that you eat fish twice a week. So salmon, tuna, herring, just to name a few, are higher in the omega-3s, which are considered the essential fatty acids and good for heart health. Now we're going to take a closer look at foods. Whole grain contains the entire kernel. So when you're looking at the ingredient list, you want to choose a product that has whole grains listed first. And some ways that you can make some simple switches to whole grain, aside from, you want to look at those nutrition labels, you can eat 100% whole wheat bread or bagels, trade out and use brown rice instead of white rice, try whole wheat or rye crackers. Looking at your cereal, opt for a higher fiber whole grain product or oatmeal, even changing your pasta to whole wheat pasta. Can be some small, simple switches that you can take to get more whole grains in your diet. Fruits and vegetables, rich in vitamins, nutrients, antioxidants, fiber. You can make simple switches to your diet to help you eat more fruits and vegetables. Try to include different colors. The more color, the greater the variety of nutrients. So in the morning for breakfast, try maybe adding berries, a banana to your oatmeal, your cereal, your yogurt. If you're making an omelet, maybe cut up extra vegetables, peppers, tomatoes, mushrooms. Try to throw a little bit more vegetables in your breakfast. If you know you're going to be sort of on the go and moving quickly that day, grab an apple or a banana, a peach, something that you can kind of grab and go and know that you'll have something healthy on hand. If you can double the amount of vegetables that you're eating, try adding more to salads, soups, casseroles. If you're somebody that's trying to prepare ahead, having those vegetables cut up and ready so that when you get home from work, they're already ready. Just kind of throw them together. You can make a nice, healthy salad. Also, you could try making a smoothie in the morning and drinking 100% fruit or vegetable juice. And that's some easy ways to get in more of your fruit and vegetable servings per day. Protein's an important part of your diet. It helps, keep your hunger at bay. It's also, important that you are choosing the right types of protein. So you want to go for leaner cuts of beef, looking at ground sirloin, something that's 93% or leaner if you're looking at ground beef. Looking at the leaner pork loin, try grilling as a healthier option, avoiding things that are fried. Grilling and baking is going to be a good choice. If you're looking to have some things on hand, chicken tenderloins are good to always have in the freezer, easy to prepare. Can kind of add those and cut them up for salad or making kebabs. Seafood is fresh or frozen, is also a great way to get in some omega-3s. Look at, tuna, trout, salmon, some of the choices for seafood. And then, turkey and chicken is also a leaner option. And then if you're having, a sandwich or, filling a pita, it's a chance for you to add some vegetables in there as well. Hard-boiled egg or egg whites for breakfast. And then also the nuts and seeds, so almonds, walnuts, watching the serving size with the nuts and the seeds like the sunflower and sesame, flaxseed, but they're also a good source of protein. You could also consider choosing beans and replacing meat with beans because they're high in fiber, they're low in fat, and they usually contain no cholesterol. And they're also pretty versatile, a little bit more than meat, and they're less expensive. So that's something to consider when you're looking at ways to get in extra protein. It's important to replace solid fats like butter or margarine with healthier oils, and the good fats protect your heart and support your overall health and wellness. And so, it's important to be looking for things that you could use to replace the butter and margarine, like olive oil, canola oil, corn oil. The most important thing here is just reading your food labels carefully and picking those better fats. Dairy products provide health benefits, number one being bone health. This group has a lot of nutrients that are vital for your health and maintenance of your body, and that's the calcium, potassium, vitamin D, protein. You want to look for low-fat or non-fat milk, cheese, and yogurt when you're shopping, and read your nutrition labels to make sure you're picking a good selection. Soy milk, rice milk, and almond milk are also good choices for vegetarians. And so that with that group, that's something to consider when you're picking out those things, because you need the dairy products, but you want to make sure that you're selecting the ones that are lower in fat. Remember that your expectations and goals have to be realistic, or you'll never get to where you want to be. So you want to set a goal. You want to define the outcome as specifically as possible. And it's important that if you're making goals, that you're making them obtainable. You want something that you can reach. So if you have a weight loss goal of 50 pounds, it may be easier for you to set smaller goals along the way. So 5 pounds sounds much more feasible than 50 pounds. If your goal is to exercise, start with 5 to 10 minutes. And then if your overall goal is to get to the 30 minutes 5 times a week, you set those smaller goals and you celebrate those small successes along the way. You want to understand, with making the goal, how your life will change when you reach that goal. And then you have to sort of constantly remind yourself that these are the benefits of achieving this goal. And these are the steps that I'm going to take. And try to focus on the positive. There are going to be days where you don't eat as well or you don't exercise as much as you'd like to. It's important that you stay positive. You keep moving forward. That change in behavior or that change in that eating or exercise doesn't define your entire week. It's just that one day. And so it's, trying to focus on the positives and seeing, what can be or what could be with that goal. Some screening tests that are recommended for optimal heart health. Your physician will want to know what your blood pressure is. You may be asked to get a cholesterol panel, which includes your total cholesterol, your HDL, LDL, triglycerides, also BMI and a waist circumference, a fasting blood sugar, and you may also be asked to get a stress test or an EKG, and that's something that would be decided between you and your doctor. A big step in determining your risk for heart disease is seeing your physician and having a thorough examination. It's an important part to help you set and reach goals for heart health. If you know what your numbers are, you know your cholesterol level, what your BMI is, your blood pressure, you have better control over your health and your heart disease risk. So it's important to have that good rapport with your doctor and keep those numbers under control. When you go in for your appointment, be open and honest so they have a clear picture of your health and your risk factors, and then ask questions. Make sure you understand what the doctor is saying about your health and wellness and what the plan is moving forward. February is Heart Disease Awareness Month, and so you may see people wearing ribbons of red to show support for this campaign. And this is also a good month to remind, a good month as a reminder for your health coach, just to let them know how you're doing, if you have any goals for heart health, and to know that they and that we are here to support you. The My Pathway to Health website has many different education materials in the library. We have interactive tools and calculators. So contact your health coach today with any questions. This concludes the webinar on healthy habits to prevent heart disease, and I hope everybody has a good day.